Folate's potential to influence autoimmune disease is a quietly powerful aspect of its role in health, offering fresh hope in a landscape where many struggle to manage unpredictable flare-ups and chronic inflammation. While folate is best known for its contributions to DNA synthesis and methylation, emerging research shows it may also help modulate immune function, making it a subtle but important player in the complex dance of autoimmune disorders like rheumatoid arthritis, RA, systemic lupus erythematosus, SLE, and others. Central to this connection is folate's essential role in regulating methylation, not just for gene expression in general, but specifically for genes that control immune cell activation and cytokine production. Balanced methylation helps ensure that immune cells like T and B lymphocytes react appropriately, attacking pathogens while tolerating the body's own tissues. When folate is deficient, methylation becomes disrupted, potentially contributing to the loss of self-tolerance that characterizes autoimmune disease, where the immune system mistakenly targets healthy tissues. In rheumatoid arthritis, a disease marked by chronic joint inflammation and systemic immune activation, folate's benefits may extend beyond methylation into direct therapeutic applications. The most widely used first-line treatment for RA, methotrexate, is a folate antagonist. It blocks folate pathways to dampen immune cell proliferation and reduce inflammation. However, this same mechanism also causes side effects like mouth sores, gastrointestinal upset, liver toxicity, and elevated homocysteine levels, which can increase cardiovascular risks. Supplementing with folic acid or L-methylfolate alongside methotrexate has been shown to reduce these side effects without compromising the drug's effectiveness, allowing patients to continue treatment longer and with greater comfort. This alone highlights folate's unique and underappreciated role as a supportive therapy in autoimmune care. But folate's influence in RA and other autoimmune conditions may go deeper. Some studies suggest that optimal folate status may help regulate levels of inflammatory cytokines like tumor necrosis factor alpha, TNF-A, and interleukin-6 (IL-6), both of which are key drivers of autoimmune-related inflammation. By supporting proper methylation, folate may contribute to a more balanced immune response, potentially reducing the intensity or frequency of flares in diseases like RA, SLE, and even inflammatory bowel diseases like Crohn's or ulcerative colitis. Another intriguing aspect is folate's role in maintaining the health of the intestinal lining, which is central to immune system education. The gut-associated lymphoid tissue, GALT, constantly samples intestinal contents to distinguish friend from foe. Damage to the gut barrier, sometimes referred to as leaky gut, can expose immune cells to undigested food particles or microbial toxins that may trigger or worsen autoimmune responses. Folate, by supporting rapid turnover of intestinal epithelial cells and maintaining gut integrity, may help reduce this potential immune overactivation at its source. Finally, folate's ability to regulate homocysteine levels offers another layer of protection, since elevated homocysteine has been linked not only to cardiovascular disease, but also to systemic inflammation and oxidative stress, both of which can fuel autoimmune activity. Together, these insights paint folate as a quiet but powerful modulator of immune health, offering multiple avenues for supporting patients with autoimmune diseases, from reducing methotrexate side effects to potentially calming inflammatory cytokines, to preserving gut barrier integrity. Ensuring optimal folate intake through foods like dark leafy greens, beans, and fortified grains, or bioavailable forms like L-methylfolate when absorption or genetic factors limit folate utilization, could therefore be an essential, underutilized tool in managing autoimmune conditions more effectively and comfortably. By recognizing folate's subtle but significant contributions, we unlock a valuable ally in the quest for better control over the unpredictable challenges of autoimmune disease.